According to the Occupational Outlook Handbook, 2010-2011, nuclear medicine technologists need a variety of skills and have a variety of options for a degree. There is keen competition for many positions and jobs, so degrees and experience are important. Quote, technologists with training in multiple diagnostic methods or in nuclear cardiology should have their best prospects, end quote. Nuclear medical technology programs vary from a certificate to a bachelor's degree and from 1 to 4 years of training. As stated in the Occupational Outlook Handbook, quote, courses cover the physical sciences, biological effects of radiation exposure, radiation protection and procedures, the use of radiopharmaceuticals, imaging techniques, and computer applications, end quote. Quite a few universities offer bachelor's degrees in nuclear medical technology. For example, the University of Iowa, the Charles R. Drew University in Los Angeles, and the University of Alabama, Birmingham all offer 4-year bachelor's degrees in this subject. There are currently more than 100 programs available. Additionally, a program of only 1 year is available for certain health professionals who already have attained a bachelor's degree. This can also be for people who want to change their field and or specialize in nuclear medical technology. As of 2009, 25 states require licensing for practicing nuclear medical technologists, and more insurance companies need it in order to reimburse imaging procedures. This means that any aspiring nuclear medical technologist should carefully check requirements in the location where he or she plans to work. The American Board of Radiology has sample questions from their certification test on their website. Finally, there are several skills a person in nuclear medicine should have. The Occupational Outlook Handbook has a paragraph on the skill necessary for nuclear medical technologists. As stated in the handbook, quote, technologists must have good communication skills to effectively interact with patients and their families and should be sensitive to patients' physical and psychological needs. Nuclear medicine technologists must be able to work independently as they may have little direct supervision. Technologists also need to be detail-oriented and meticulous when performing procedures to ensure that all regulations are being followed, end quote. What spurred your initial interest in nuclear engineering, particularly in regards to medicine?
I was particularly interested in how radiation, both ionizing and non-ionizing, could be used non-invasively to give very good pictures of internal human anatomy and function. We took an imaging class senior year of MIT, and that motivated my decision to choose nuclear engineering. At the beginning, we learned radiobiology, and I knew I had made the right decision. The interaction of radiation with living cells was fascinating in terms of the physics and resulting biological effects. If interested in this, look into how we have used the data from Japan to learn about how varying doses of radiation affect human health.
Where are you attending medical school? Why did you choose this particular school?
I go to St. George's School of Medicine in Grenada, West Indies. I chose this school because I was not able to go to do an international study experience as a nuclear engineer, and there was a largely international focus at this school. For instance, I will be studying medicine in Thailand this summer. Also, we do clinical rotations in the New York area, where I would like to do my residency, so it was the best choice for me, although slightly different for someone from MIT.
What are your career goals?
I am interested in surgery because imaging introduced me to anatomy. However, I plan to use my degree as I became very passionate while working at Children's Hospital on the topic of safe use of radiation in terms of dose minimization. I thoroughly enjoyed obtaining my degree in nuclear engineering and plan on incorporating this into my career as a physician. Though I am still interested in imaging, I am finding that in medical school that I may be more interested in going into the field of neurosurgery in order to work with radiation oncologists in stereotactic radiosurgery, using equipment such as the gamma knife. The use of radiation in medicine can be in diagnosis or treatment, and currently, I am leaning towards its use in treatment.
There are 4 main factors that affect the salaries of careers in the medical nuclear engineering fields. First, level of education. Where did you receive your degree? How advanced is your degree? Bachelor's, master's, doctorate? Second, location. Are you in the big city or a rural town? Urban areas generally pay higher salaries. Third, specializations. Certain specializations can greatly affect your salary. Perhaps you focused on radiopharmaceuticals in school, or perhaps you followed the path of a nuclear diagnostic physicist. Because you are more specialized in certain areas, being employed in your specialization will mean a greater salary due to a better fit for the job. And fourth, experience. You have to start somewhere, but the more experience you have, the better you are at what you do. This graph shows individual annual salaries represented by dots for medical nuclear physicists, and the red line represents the average salary. According to one estimate, the national average annual salary for a nuclear medicine physicist is approximately $92,000. Other estimates place annual salaries in the range of $80,000 up to $140,000. Estimates of the typical salary for a medical nuclear pharmacist are around $117,000. With experience comes an increase in salary, and some nuclear pharmacists are paid up to $140,000 annually. Nuclear pharmacists receive higher salaries than regular pharmacists because they are specialized in preparing and administering radiopharmaceuticals. Numerous sources show the average salary for nuclear medicine technologists, who are different from technicians, is between $54,000 and $59,000. As with most careers, more experience equals more cash. According to the chart, annual salary increases substantially with experience. Also with experience comes opportunities for advancement. Nuclear medicine technologists may advance to supervisory or chief technologist positions with many years of experience. With higher education, nuclear medicine technologists may even become department administrators or directors. In this field, a wide range of other possible career choices are also available, such as radiation safety officer, instructor, or even director of nuclear medicine technology programs, training representatives for medical equipment or radiopharmaceutical manufacturing firms. Along with typically high salaries in the nuclear medical field come many benefits. Medical physicists typically receive the following benefits, among others: medical and dental insurance, life and disability insurance, malpractice insurance, child and elder care, and tuition reimbursement. Benefits for medical nuclear pharmacists include long paid vacations, additional bonuses, and health benefits that are typical of the field of pharmacy. Medical nuclear engineers have a major, but often unnoticed, impact on society. Medical nuclear engineers may be employed at pharmacies, at hospitals, in academia, in industry, or in government or private research laboratories. Medical nuclear engineers may be involved with non-invasive diagnostic procedures such as X-rays, MRI scans, CAT scans, and ultrasounds, as well as more advanced nuclear imaging procedures such as positron emission tomography, single photon emission computed tomography, cardiovascular imaging, and bone scanning. They may also use gamma cameras, a technology that produces an image based on gamma radiation emitted from radioisotopes in the body. Medical nuclear engineers may also be involved with treatments such as targeted cell therapy, a leukemia and cancer treatment technique in which radio-labeled molecules are used to deliver radioisotopes specifically and exclusively to cancer cells, irradiating and killing them.